Welcome back to TV5 News at 9. It's now time for Medical Moments with Covenant Healthcare. Joining us this morning, we have nurse practitioner Rachel Bryant. Thanks for being here.
Yes, thank you for having me.
So Rachel, today we are talking about cardiomyopathy and heart failure. It is the first week of American Heart Health Month. Just to get started, can you explain what is cardiomyopathy?
Yeah, that's a great first question. So when we look at the actual term cardiomyopathy, if we break it down, it literally means heart muscle disease. So when cardiomyopathy occurs, the normal heart muscle is affected, and that can cause it to get thicker or to stiffen or even to thin out. There are kind of two categories of cardiomyopathy that we use. One is called ischemic, which means lack of oxygen, and the other is non-ischemic, or not caused by a lack of oxygen.
And how is this linked to heart failure?
So when cardiomyopathy happens, and typically, especially if it doesn't get detected right away or if it goes untreated, it can affect how well the heart is able to pump. So when the pumping function is affected, it makes it so the heart isn't able to take all of that nice oxygenated blood and push it out to the rest of the body, so like our cells can get all the oxygen and nutrients it needs. With heart failure, when this kind of happens and that pumping function is reduced, the heart can't keep up with the normal demands that we place on it. And even simple things like just, kind of walking from room to room can cause issues, and it can have like this backflow of fluid that can kind of manifest with those heart failure symptoms.
Okay. So who is at risk for this disease, and can you just explain how serious this is?
Yeah. So the most common risk factor for cardiomyopathy is something called coronary artery disease. With coronary artery disease, or CAD, it is this kind of like fatty deposit buildup or plaque buildup that happens in those arteries that feed the heart. When this happens, it kind of narrows that artery, and that affects like how well the heart is able to get blood and oxygen, which then can affect how well the heart's able to pump. That's kind of the most common risk factor, and that can lead to heart attacks. The other kind of most common risk factors are going to be having high blood pressure. There can be issues with the valves of the heart, atrial fibrillation, untreated sleep apnea, having diabetes, and then having obesity, using alcohol, drug use, and even tobacco use can all really increase your risk factors of developing cardiomyopathy. When we're looking at, cardiomyopathy and heart failure, it is unfortunately a really serious condition, and it's one of those, it's a lifelong chronic condition. So we utilize these kind of, very thoroughly researched guidelines to help us, help those individuals kind of get the best function out of their heart. And the good news is that by implementing these medications, by kind of reducing how much sodium or salt intake, and even reducing the overall fluid intake, we can kind of help with the quality of life. We can sometimes help improve the squeeze of the heart, and then obviously help alleviate those symptoms of heart failure.
Well, you've listed a few of these already, but are there any signs or symptoms we should watch out for?
Yeah, so with coronary artery disease, kind of the most common symptoms that we discuss with patients are going to be, feeling this like chest heaviness, chest pressure, chest tightness that typically happens when we're doing physical activity, and then once we rest or kind of stop that activity, that pain or pressure kind of subsides. Another big risk factor, or kind of something to watch out for, is if you feel like, oh, my heart just feels like it's like beating really fast, I'm just sitting here, or I feel like it's just like, skipping a bunch of beats. That can be an issue with the top chambers of the heart called atrial fibrillation. Those are kind of the biggest signs and symptoms to watch for that. And then with heart failure, we want to watch for shortness of breath that can occur with activity or without activity. Some people experience where they can't lie flat because it makes them feel like they just can't get a breath in, or even they'll wake up at night feeling like they can't catch their breath. The other kind of most common symptoms of heart failure are going to be kind of swelling that can happen typically like down in the legs and feet, but sometimes it can happen around the abdomen. And then weight gain, and things like rapid weight gain of like, I'm up 5 pounds in a couple of days.
Yeah.
Those are, again, the most common symptoms to watch for.
So if someone is experiencing any of these symptoms or they have concerns about their heart health, where can they go to get some help?
Yeah, so I'm a huge advocate for having a primary care provider or PCP, because we want to catch a lot of this before it happens. So I think they say like the best medicine is no medicine. So preventative care is key. So if you're having any concerns or you have a high family history of heart issues, I would definitely start with your PCP or primary care provider. They can, ask a bunch of questions, do the physical exam, and then order any necessary blood work or kind of diagnostic testing. Depending on kind of those results, then if we need to be, if someone needs to be seen with cardiology, they can kind of go there. Now, if someone is feeling like, this is like a medical emergency, just go right to that emergency room.
Right. Well, these are all good tips and reminders, Rachel. Thank you so much for being here.
Thank you.
If you would like to learn more information on today's topic, just head over to the hot link section on our website at WNEM.com.